While the economy is on the minds of many people, there's the threat of swine flu, or H1N1. It's on the minds of healthcare providers around the globe. As they gear up for what traditionally is flu season, many questions remain about how serious swine flu will become and how prepared our hospitals and healthcare systems are for handling a flu crisis. We wanted to know how serious the threat of swine flu is for San Diego County, so we put Dr. Wilma Wooten, Public Health Officer for the county, on the record, and here's what she had to say.
Swine flu threat, and we now refer to it as pandemic H1N1, previously known as swine flu, is a very serious condition. We are now in a pandemic situation. The World Health Organization elevated their alert phase from 5 to 6 in June. So we are in the middle of a pandemic. Luckily, the pandemic influenza activity has been mild or comparable to a mild flu season. And while that's good news, the fact is it is widespread throughout our community, and it is responsible for complications due to influenza and even deaths. As of midweek this week, we've had 19 deaths in San Diego County alone associated with this new or pandemic influenza virus. When the vaccine is available, that actually will be the single most important thing that we can do, but we don't have that now. So right now, the important thing people should do is stay home if they're sick. And then they can return once they've been afebrile for 24 hours without the use of fever-lowering medications. And practice those preventive strategies: washing your hands, covering your cough if you are sick, and going home. And if you don't have water and soap, using hand sanitizers. That's also an important strategy that people can utilize as well.
So, Tony, other than working on vaccines, how prepared is our medical community for dealing with this pandemic?
Well, like all public agencies, it doesn't staff up for the maximum use. The fire department doesn't staff up for the 100-year fire, and public health is the same way. We've got hospitals and we've got emergency rooms, and we're getting our share of the vaccine. But if it starts to hit, as the state is warning, 1 out of 4 Californians, we could be in trouble. That's why Dr. Wooten, who I think has done a terrific job throughout this whole pandemic, is saying, wash your hands. Your mother was right. Wash your hands before you eat and after you eat. That'll cut down. When you start getting sick, stay home. Don't go to school. Don't go to work. Stay home.
Okay, well, I'm listening to you, Tony. I really am. But the truth is that when it hits, it's very possible that emergency rooms are going to be just overwhelmed because already they're overcrowded.
Right. Probably
can't handle more patients. What can we expect when flu season hits?
Well, I think that's a big question mark. We don't know what to expect, but the public health agencies, the public health system is preparing for the worst, and I think that's a good thing. I think that business and other sectors of the economy are not really prepared for the worst part of this. And I think business especially needs to ramp up and think about having backups in various positions, especially critical positions, because people are going to get sick and they're going to have to stay home. Otherwise, the pandemic, as they call it, could get worse.
Dr. Wooten mentioned the vaccinations, and there's going to be this tiered system which favors younger people. How disruptive will a so-called tiered system be? I mean, if you're older, you're not going to be able to be given the vaccinations potentially.
Well, it favors certain groups that are the most vulnerable, the youngest, pregnant women who might become pregnant, and then it kind of ramps from there. It could be very disruptive, but my hope is we never get to that point to where people are, on the street in downtown San Diego trying to score some swine flu vaccine. But the problem is that it may not just take 1 shot this year, but up to 3 shots, maybe more, as swine flu changes its genetic makeup and becomes immune to the vaccine. So if it hits those big numbers that the folks at the Centers for Disease Control in Atlanta or the folks at Public Health in Sacramento and San Diego are warning about, we could be in hurt.
Okay, thank you very much, Tony Perry and Tom York.
Thank you.